Welcome everybody to this week's Wednesday web chat, where we will be looking at the issue of coping with the mental strain of COVID-19. I think that this year, 2020, has been about COVID. Nothing else has been able to overtake. Well, maybe some things can overtake it, like what's happening in the US and the elections in various parts of the world. But I think COVID has been top of mind and has affected us in many ways physically from doing things that we're used to doing. So it has been an unsettling time, and we want to find out how you are coping. And we've got in this session three panel members who have experience with psychology and training and dealing with people and issues. We've also got a poll for you to take part in, just to get a sense of what are the issues that are top of mind. And at the end of this session, when we do the edited version of this article on the stormasia.com site, we will also have a survey which has been put together by one of the panelists, Varian Montero, who will explain what it's about. But let me just introduce our panelists. We've got Lena, who's Deputy Director of Children at Risk Empowerment Association, CARE Singapore, where she is in charge of therapy and mental wellness services. Lena is a certified psychotherapist who has more than 15 years of experience working with vulnerable youth. She is a registered counselor and a registered clinical supervisor with the Singapore Association for Counselling. Welcome, Lena. We've got Laika Jumabhoy is a clinical psychology master's student at the moment and a mother, a new mother. Laika has a background in psychology and has worked the last 4.5 years supporting survivors of domestic and sexual violence in Malaysia and Singapore, most recently as a senior case manager at AWARE. Welcome, Laika. And we've got now Varian Montero is a counseling consultant at the Relational Counseling Studio. Varian has honed his personal interest in psychology and counseling into a career that he hopes will help his clients balance their mind, body, and behavior. Welcome, Varian.
Hi, everyone.
Welcome, everybody. Now, just based on your experiences during this period with people that you've interacted with, has there been a rise in addictive behavior, things like online shopping, eating, exercise, amongst the people that you've met? And do they see that as issues that they feel they need to address? Lena, any thoughts?
Well, I wouldn't say addictive behavior because those callers, as we in CARE, we meant the online psychological first aid in response to the current situation, the current COVID pandemic. It's called Here For You, and we do have callers calling in for help. Most of the issues that they talk about are related to job losses, financial distress, health related. It's not so much skewed towards addictions such as shopping online. Although I must say that I believe there are people who are spending a lot more online because of the confinement at home, instead of being able to be physically at the shopping mall, where you have, at the click of a button, you get to see all the things that's online, and it's a lot of impulse purchase, isn't it? But whether it's classified as addiction, I'm not so sure whether those callers are the ones that are addicted to shopping or online shopping. Okay. But definitely there are other mental health issues that we call in.
Sure, and we'll get to that shortly. Yeah. Laika, how about yourself?
So I run an online support group for trauma survivors, and I'm not sure about, again, whether it's an addictive behavior, but coping with the stresses of not knowing if they still have a job and all those kind of things mean that some participants have shared that they spend a lot more time surfing, shopping websites, just spend a lot more time looking things up online, possibly as a way of coping or distraction.
Okay. and Varian? This is up your street to some extent, right?
I suppose you could say that. No, I'm in agreement with Lena and Laika. There will definitely be an increase in online purchases because of the whole COVID situation. Does that mean that there is an addiction or addictive tendencies? Not really, but there is definitely an opportunity to develop those tendencies, especially if it's used as a coping mechanism. And they get this nice little burst of good feelings when they get a purchase. They're like, oh, wow, they have a present. And what happens if they buy another one or related products? And actually, just to kind of deviate a little bit, shopping is one of the popular secondary addictions that we find are present in those who are in recovery. So I suppose in this situation, they would have to really be aware of their spending habits because it can easily fall into a full-fledged addiction, right, during the COVID.
And you think online retailers are taking full advantage of that? Have they, if they figure out the psychology of their potential customer, they would make full use of it, wouldn't they? Even the slightest
really
discount
good
is still.
You can see that side panel that they have that says related products or people who bought this product that you're buying also bought this. Wouldn't that be a good idea?
Yeah.
I think on the note of addiction, sorry, I'll just chime in here since you're talking about addiction. Apart from shopping, I think with the confinement during this period, we do see an increase in alcoholic addiction. Because you are already confined in your own personal space, and when you don't have things that you can do productively, you just it's like the liquor bottle is there, it's just calling you to pick it up. So alcoholic addiction is on the rise.
So would these be some of the issues that you've been facing with the helpline that you have, Lena?
Not, as I mentioned earlier, it's not the addiction, but mainly due to the job losses, business failures, what we call the new poor. Suddenly you are a business owner, and then overnight you have to pay very hefty rental, but no business, and you just get your business just sort of fall apart. You lose your job, or you lose your business, or you can have issues with, that's also resulting in an increase in domestic violence as well, and issues of health, especially for those with pre-existing health conditions. There's also this health concern, and all leads to any one of these domains of concern. It leads to stressors in their life.
So what can people do about that? I mean, one would be trying to identify the situation and what you might be going through, and Varian has come up with a survey which will be useful, and I'll let you explain that shortly. But now, what can people do beyond identifying, or this might be a situation? What can they do to resolve it or reduce the impact of the severity of the impact that they might otherwise not realize? So you offer counseling services, right? Yeah.
So maybe I just chime in here. So I guess it depends on the presenting issues. If it is a financial, job-related issues, when they call in here for you, we normally try to refer them to the relevant resources, such as SkillsFuture, for them to go and get some, or SOS or SSO, the relevant resources that will need that could help them. And then we also try to do a triage when they call in, and during the triage, do a relevant referral, whether is it to a specialist, if it is a severe mental health condition, or if it's just a distress where we could still give them some coping skills. So there is a difference between a caller with presenting mental health illness and someone with mental health distress. So they are different. So we try and do a triage when they call in.
Okay. Laika, in your case, you've been away from aware now since the start of the year, but in these sort of situations, what sort of issues usually come up?
So, I mean, it's been written about quite a fair bit in the papers as well that there is an increase in domestic violence and sexual violence cases across the pandemic. And it's for multiple reasons, right? Previously, people that in houses where there were violence, there was some respite when spouses would go to work, right? Or people could leave the house, go to safe spaces, or they might have some privacy to call a helpline. But these avenues are, well, now they're opening up, right? But even so, a lot of centers are only doing Zoom or phone sessions and not doing in-person sessions unless it's really urgent, which makes sense due to safety concerns. But I mean, even in the support group that I co-run, there are times that participants will say, I really wish I could join today's session, but my parents are home, I don't have a safe space to talk, so I can't join today. You know, or things will happen in between, or so there are all these new situations to also navigate. That while things are opening up, it's still very relevant as well.
Okay. And wherein, do you want to talk a bit about your survey?
Oh, sure. So basically, it is a combination of the generalized anxiety disorder 7 and the personal health questionnaire 9. It's a screening tool, so it's not an official diagnosis, but it's used to screen for signs of anxiety and depression and general mental health. 10 questions, and the answers are from not at all to daily or all the time in the past 2 weeks. And this is really just to give people an idea of where they're at, what they've been experiencing. I mentioned earlier to Lena and Laika and yourself, Kanan, that sometimes during even not just during COVID, but in life generally, we just tend to whiz past without looking inward and trying to see how we're really feeling or what is really happening to our body or to our soul. So this would force the person to kind of look at their symptoms, shall we say, how they're feeling, sensations in their body, emotions. And if they score they hit a certain mark, they score high enough, then they should seek some kind of therapeutic assistance. So not necessarily seek counseling. They can seek a peer, they go for these online support groups. But if they score high enough, then there's a key down there that says, they really should seek some kind of assistance.
Okay. And we will be running that survey on the Storm Asia site together with the edited version of this discussion. Feel free to make use of it. It's for yourself. But wherein does it also help if you do it and somebody does it with you in mind? Is that something that will be helpful? Because what you think of yourself may not be what somebody else thinks of you.
I don't know, that might cause some kind of avoidable quarrel, maybe. It's like, oh, you're like this. It's like, no, I'm really like this. But I think normally inventories and questionnaires, we need to give the responsibility to the person taking the inventory. And I did put down their answer as truthfully as possible. So it really works if you are truthful about it. Having someone else take the inventory for you might not be as accurate.
Okay.
Yeah.
Okay, there are truths.
This is a self-reported inventory, but there are certain assessments whereby, say for example, the child is too young. If it is a certain kind of a screening tool to assess the child's traumatic experience, for example, then possibly the parents could, do an assessment on their opinion of how the child respond, at home or that kind of stuff. So this is slightly different.
Yeah, thanks for raising that, Lena. Just a reminder to the viewers that this is for adults, so 18 and above, right? If you take it yourself, it's not for children. Thanks for reminding me.
Okay, so that should be included in that as well. So is there something for children then? Because I think for children, this would be quite unsettling, right? Suddenly they used to go out and run around, and suddenly they can't do that. They may not be able to get their heads around the reasons for it, other than COVID. But what is that, right? You can't see it, you don't know what it is, but all you know is you can't do certain things. So, what would you recommend for children like that? You know, how do we deal with that situation?
So at CARE, for example, we do also provide a psychological assessment, and in terms of assessing the trauma possibility in a young child or even a youth. So we do have the CAT scores, the child and adult trauma scores, and we also do anxiety scoring, or even the VAX depressions index scores. So they are for various different age category. So like I mentioned earlier, so if the child is too young, so maybe it will be done by the child. At the same time, it's done by the parent to give an assessment of what's the parent's perspective of how the child behave at home. Say, for example, after a domestic violence at home, and the child has exhibit some form of signs and symptoms of trauma, and then going through the counseling or therapy process. In the intake session, we will interview with the parents, we will interview with the client, we will get them, client as in this case the child, to get them to fill in a survey or questionnaire. So it will be a questionnaire done by the child or the youth and the parent. So to give a more complete and holistic assessment before the treatment and during the treatment and after the treatment. So it's a pre, mid, and post kind of assessment.
What are the factors that have come up as a result of these surveys? I mean, have you identified any trends or any trigger points emerging as a result of talking to various families and getting their feedback?
If in terms of domestic violence, for example, they would give feedback in terms of how they feel and also how they witness whether is it the parent or is it the siblings having aggression towards each other. So this will be part and parcel of the inventory items that they fill in. And for example, one of the score item will be the nightmares, the flashbacks, and do they have any physiological symptoms such as cold sweat, nervousness, etc. So it's quite a comprehensive inventory tool that the child is going to fill up, as well as the adult is going to fill up. So it assess on the trauma skills, it assess on the anxiety skills, as well as the depression skills. Because when you have excessive of anxiety as well as sleepless nightmares and things like that, there is a likelihood that it is a correlated or there will be a comorbidity that occurs together, and depression is one of the possibilities as well.
How else can anxiety sort of manifest itself? We talk about excessive perspiration or whatever, or inability to sleep and things like that. Are there other signs that you got to be mindful of for, say, parents with their children, or even amongst family members who are not children necessarily? Are there signs that you can watch out for to take note of, so that you can ask questions or talk to them or address a situation that might be lurking there?
I think in my context, because we work with youth in the primary and secondary schools, so a lot of the face value that we can see from, as in the child not coming to school, or when they even show up in school, they can't focus, they can't pay attention in class, or they sleep in class, or you get to see the black eye, eye bag.
Eye bags.
Yeah, and these are the visual signs that we can see. and lack of ability to concentrate. And in our team of youth workers and counselors that are supporting the students in the school, our counseling team would also be calling the students out and talking to them. I noticed you were restless, or you were feeling very tired, and your head was on your hand, and you're not paying attention. Is there something? And so we try to explore with the kid what happened, and sometimes they would share with us. Normally, because there is a good rapport between the team and the youth, and they would share with us that, last night dad and mom quarreled again, or there was a fight, or I would have been online gaming till 4 a.m. and hence I couldn't wake up, or I've been busy texting my friends, or I had nightmares. So these are the one-on-one conversations during our befriending session, so to speak, to get to know what their habits.
Behavior changes would be quite important in this as well, especially if it's people you know, right? If there's a sudden change in behavior, will be something to take note of, right? I mean, Laika, with your interaction with domestic violence situations, what were some of the key things that popped up which you feel would be useful to share with the audience?
When we're talking about behavior changes, is that what we're...
Well, behavior changes, or generally if somebody's under stress or the relationship is under stress, what are the kind of things that you need to be mindful of?
I think there's a difference between domestic violence and marital conflict or stress, because they're two very different things on the spectrum. So if it's in a domestic violence situation, it's pretty obvious in that there would be increased incidences of either physical or emotional or sexual violence. And in that instance, safety and risk of persons in the house, that comes into play, right? So those are very obvious signs. But in terms of general anxiety levels, or general levels of stress, signs to watch out for. Like you made a really good point about changes in behaviors. If a person is generally talkative and outgoing, suddenly becomes withdrawn, then that's a good indicator to check what's going on. It may not necessarily be anxiety, but it is an indicator that something is not quite right. If, for example, a person is increasingly irritable or snappy. Lena already pointed out changes in sleep pattern. I guess for children, in past work experiences, they would also speak about not wanting to go home or intentionally staying back at school, right? So you would ask them like, hey, what's going on? They would say, oh, they just like the school canteen, or they just like staying back, right? And no school canteen is that fascinating. So you would want to check what's the reason that this child is showing reluctance to go home or staying late as well.
What will the long-term impact of COVID be, you think? Will there be issues around behavior, or how people are trying to get back to a normal way of living, which might be a tough part for them to take on? Do you anticipate long-term issues cropping up as a result of COVID?
I guess on the issue of violence in households, I think there will be long-term repercussions, because there are no signs of the pandemic, disappearing just like that. So people's livelihoods have been impacted, people's ability to drop their children off at childcare, all these things have long-term consequences. So I think in terms of at least the trend of increasing domestic violence cases, it will take a while before it sort of flattens out. I don't know, Lena, what do you
Yeah, I agree with you. I mean, the world is facing a global public health crisis, for the past 6 months since the outbreak. And besides the rising numbers of cases and fatality with this pandemic, it has also been significant impact to the social, economic, political, and psychosocial impact. So the social isolation alone can lead to chronic loneliness and boredom, especially for those who have lost their job, they decide, or they're homemakers, or they have pre-existing health condition that they are confined to home. And if it is long enough, it can have a detrimental effects on the physical as well as the mental well-being. And the timeline of this growing pandemic is still uncertain because we are all still, it's anybody's guess when is the vaccine available, right? And the isolation, especially during, the early circuit breaker time, and also with the compounded problems that escalate due to the social economic impact. People are still losing their jobs, shops are still closing down. I mean, thankfully, we do have government subsidies for the free tenant rental, or even subsidies for the solidarity, and the fortitude budgets. This helps to cushion some, yeah. However, the start of the pandemic and the compounded period and the compounded anxiety, coupled with the uncertainty of this relatively unknown infection, does increase the anxiety. And so we are looking at keeping a close eye on all these possible signs of distress coming up. Some research has shown that there is a very steep increase in terms of mental health distress worldwide. So earlier on, Kanan, you mentioned about the behavioral aspect. I think in terms of the common signs of stress that we as practitioners normally look at when we conduct a psychological first aid, when we meant the online helpline, or we call it the PFA, we look at 3 main domains. One would be the physical well-being of the person who called. For example, do they fall sick very easily? Are they, having outbreak of cold sweat? They're talking about always having migraine, headache, having difficulty in breathing because they're confined in the same space. They are afraid of getting out into a mall, or having sleep disturbance, as what mentioned earlier. Heartbeat, irregular heartbeat, rapid heartbeat, or even simple thing as diarrhea. So these are some of the physical signs. And then we also look at the emotional signs, such as whether this person has got a lot of anger, fear, or extreme sadness, or even shame and guilt. As well as the third domain, which is the mental part of it, which is are they slowly exhibiting poor signs of concentration? They tend to forget things, or are they hypervigilant, or are they losing their sense of reality, or having flashbacks, easily irritable? This easily irritable will be the behavior aspect that you talk about, or inability to feel positive. It's not easy to feel positive during this time frame, but it doesn't help to feel negative, right? So the positive aspect and being able to have a routine to go on with your day-to-day does help in terms of managing the sign, the stress. Of course, sense of loss, etc. Yeah.
Sure. So in the case where people are working from home a lot, there's a question from Sanjay. How do employers and leaders detect changes in behavior that could indicate stress within their teams if people are just working from home and you only see them like this on a video chat? How do you spot issues that might be lying there that you may need to address?
Let me give you one anecdote example of a caller. He called because of one of our Here For You hotline, helpline, and that is he was facing work stress. And he is one of the frontline responder. And being a frontline responder, his workload not only double or even triple. He has to still go back and enter his system on the cases that he's attending to at the hospital. And he felt that you know, is normally he's trying to clear his inbox, his emails, you know, it's like 200 to 300 a day. But because of this pandemic, it doubles. It became 500 to 600 emails, and he told me he just couldn't cope anymore. You know, it's like doubling the emails. How am I going to cope? So he thought to himself, oh, maybe I will just put it aside, take a break. The next day, then I will come and take a look at it. And the next day, my goodness, it doubled up to 1,000 over emails, and he started to have panic attack, and he's not responding. So for his bosses, one way to also take note of is checking on your staff well-being, and whether or not they, you know, I think periodic checking in with them to ensure that the front line or even any of the colleagues who are working, to ensure that there is the self-care portion. I think it's so important, not only for normal working people, but especially so for frontline responders, because there is a tendency that they, in their zest or passion in trying to reach out to help, they have a high tendency to forget about self-care, and burnout happens. Yeah, so like in this example of this caller, he realized there's this heart palpitating, and he realized that he suddenly felt the anxiety when he turned on his computer, and he realized, gosh, you know, there's so many emails and I can't cope, I'm just going to turn it off. And then he outbreak into cold sweat, and his heart started palpitating, and that's where he realized, oh, I've got a helpline, you know, I'm going to call. So, you know, then I managed.
So what did you recommend to him?
So I helped him to understand his physical response to this kind of anxiety, because it's a performance anxiety that he's having. At the same time, there is also a sign of burnout, because he's really so burnout in trying to get out, helping out, to help out the COVID patients, and he's got to come back and do his desk work as well. So it's a lot of work that he's doing beyond his ability to cope. So what I, you know, do some psychoeducation to help him understand that the stressors is when you have when you are stretching yourself beyond your ability to cope. That's where your body is showing sign. Your body is telling you that it's time to step back and take a break, and relook at reorganizing yourself, and look into self-care, and see what you can do, you know, to reprioritize your work. Because he was also sharing that his habit used to be clearing all the 300 meals in a day. So now that with this pandemic, he's having double the amount, which is 600 emails a day. You know, there is a certain threshold that one could handle, right? You know, you cannot keep doing that. You can do 1,000 emails and 2,000 emails a day. You have to prioritize. So
we're not robots yet.
Yeah. So and also I empower him to have a chat with his boss.
Do you think this is a situation where organizations, especially in this case, if it's a frontline person and you know that they're being severely tested, it's time for the organization to step in and bring in relief support. So things like the administrative part of things will be taken over by somebody else, so you can pay attention to what needs to be achieved on the ground. You know, should organizations have that sort of mentality rather than, oh, this is tough, you've got to, you know, just tough it out and accomplish it?
Yeah, I think organizations definitely need to. Having said that, not all organizations are mindful that their staff may be experiencing burnout or a change in the new norm. You know, like even in terms of Zoom meetings, or in terms of working from home, there is a tendency that people tend to forget about the boundaries between time to work and time to rest, because they tend to work all the way past their normal working hours, as if they are in the office, because we can easily, you know, forget that, oh gosh, I should turn off my computer now, and now it's time for me to be spending my time with my children, enjoy a wonderful lunch or things like that. You know, there is a tendency to forget about that and continue doing whatever that comes in through your mails or your work.
So if more people are staying home to work, wouldn't that be a bigger issue to deal with? The fact that people are unable to manage their time, that they will be spending all their time at work, or you cannot differentiate the various time slots for different things. Is there something that people can do to address that situation? Is that kind of addictive behavior, Viren, you think?
I was going to say that for those who actually practice healthy boundaries, they don't run into this problem. In fact, they actually enjoy working from home. They manage to see the bright side of it. And they love spending time at home. They can have lunch and dinner with their family. They spend time with their children, and they actually set a limit, like, okay, answer emails if it's urgent. They'll push a little bit, but they have a cut-off time. It's those who are not introduced to boundaries that are experiencing this problem, and they go back and they feel that they have to answer these emails. As Lena said, the lines get blurred so much that 10:30 p.m. normally they wouldn't be in the office, but they're answering emails on their mobile, or they feel like it feels urgent. So I think expanding on what
is that a company behavior, or is that a personal behavior that triggers that usually? Is it an individual response, or is it because of the company culture to accomplish
I think
things
it's
regardless?
both.
Yeah, so do
I think it's both. Sometimes it could be the company's culture, because I've heard of cases where bosses sending out emails at 3 a.m. in the morning, and
but then the employee doesn't have to respond.
Yeah.
I mean,
yes, you're right.
as a boss, you would send it out because you just want to get it off your
Yes, you're so right.
underway, right?
So
Don't
it is
expect a
both.
response at 3:01.
Yeah, it is both, because one would be the company's culture. Maybe they expect them to respond within the 24 hours, and the other one would be the self-imposed sense of urgency. So it is both
I think
ways.
it's important that you see that there's a power differential as well. So if the company and your bosses are responding to emails at 3:01 or 3:30 in the morning or all of that stuff, then I agree that it's poor boundary setting, but there's also an unspoken expectation that you will respond, right? Or there's the pressure on yourself, like how will they look at me if I say that I'm not going to respond past 10 p.m., but everyone else, the higher management, is working till 3 a.m., then are they going to reflect poorly on me? Is it going to impact my bonus? All of those things, right? So there's quite a lot of privilege that comes with being able to set your own boundaries if the company culture doesn't also follow suit as well.
I was just thinking, imagine walking up to the CEO or COO and like, by the way, this is my boundaries list.
Yeah,
Just so you no emails after 7 p.m.
Right? So, yeah.
I think under such circumstances, if the person is really feeling distressed because of work-related boundaries, it will be good for the person to engage a coach to help him or her understand how to better manage the time at office, as well as to improve in his or her communication skill with his bosses. There are some staff who are also able to delegate upwards. So it is probably having the ability to get a coach to help this person to understand and expand their circle of influence and maintain a healthy work-life balance.
Or it might even be a chat with your colleagues or upper management. Some of them are very forthcoming, very open to having that.
Yes.
So Patricia is asking whether anger management courses or such sort of courses would be helpful to reduce the statistics of domestic violence and maybe even other sorts of violence and aggressive behavior maybe. Would it be useful for organizations to look at these sort of emotional balancing courses to try and introduce so that their staff could make use of it and sort of see through this period especially?
I think it's
Are there such courses? Are there?
I think it's quite important to distinguish though between between domestic violence and anger, right? Because domestic violence is fundamentally about the need to exert power and control over somebody else. So a person who is abusive towards their spouse would probably not be similarly abusive to their bosses. So it is just that it is fundamentally the dynamic of power and control that needs to be addressed there versus anger. But yeah, anger management courses can be beneficial for domestic violence once that underlying issue has been addressed.
How about other sorts of, say, not domestic violence, but managing your emotional state in the office environment or with colleagues or with bosses? Realizing that sure, you play different roles in life, and this role requires this and this other requires. How do you? Are there sort of ways and means for people to understand that better and apply it to themselves?
Yeah, I think it would definitely help. I'm not sure currently where it's being offered. I don't know, Varian or Lena, if you know.
Yeah, I do agree with what Laika said. In terms of DV, domestic violence, the anger that is exhibited out it is a coping mechanism only. It's not one that addresses the underlying issues. So if one has got just the anger issues or anger management issues, perhaps seeking help through a counselor, therapist, or psychologist in better understanding and going deeper into the personal issues. It could stem out from a very simple change in perspective of understanding or having a better communication. But it could also be something that stems from a childhood issue that could is now surfacing, and the way this person adopts a perspective of how he relates with the world. So it could be something that is as far back as childhood, so that needs a lot more intervention work, a lot more deeper work, or it could be just a simple kind of work like a communication skill. So
Have you seen a spike in demand for your services?
Yes, we do
Lena
see.
And Varian, yeah.
Yes, we do see an increase in calls asking for help with regards to relationship issues. Not just anger management. It will just present as anger issues. Usually, it's relationship issues or challenges in managing their children or the youth that in terms of the change due to COVID. My child is not following rules. They are running out of the house to their friend's place without the mask. That kind of what can I do? The kind of FAQ.
Is there more despair than anything else surfacing? Despair on many fronts, because you're losing jobs, you're losing businesses, things are falling apart around you. You have no idea when this is going to end. Is that something that's coming up more?
Yes, certainly. Certainly is. We see a spike in terms of callers through our helpline, or Here For You helpline. There is this sense of uncertainty, and I think during the announcement of the budget, they are also calling and saying, when am I going to get my money? When am I going to get my money? Where am I going to get my money? That kind of anxiety, or I just lost my job. Can you quickly introduce a job to me? So we just got to calm them down, give them the necessary referral to the right resources, and then that's where they are able to pick up and continue. Yeah. So sometimes they just need someone to listen to, because they are at the stage of distress, but it's not a mental health illness. It's not a mental illness, but it's just the distress level, And so with a little bit of guidance, empowering them with the right resources, they are able to, most of us are pretty resilient. Yeah. We have our ability to bounce back. So it is about empowering them and giving them the right handle, the right resources to help them, and the tips to manage their stress and anxieties.
Varian, you wanted to say something?
I actually agree with Lena. I think mainly the spike that I've noticed is in unmanageability of anxiety. And sometimes it's like Lena said, it's just they need someone to just listen to them and just help them to regulate their emotions and really give them, paint a big picture for them, because the distress that they feel, the spike, kind of causes them to focus on that one thing. And then that particular negative event gets linked to another one, and then they get into this doom and gloom kind of cloud, and they can't seem to get out of this. And sometimes just having someone to sit there and listen to them and really map out their entire situation and say, well, there are silver linings, there are resources, right? It's not all doom and gloom, can be beneficial for them.
Okay. Do you reckon long-term effects of this for bosses, because business owners are, well, everybody talks about people losing their jobs. Business owners are losing, this potential losing businesses. That's probably a bigger headache for them, because not only are they losing the business, they're also losing, their employees are also losing jobs as a result of it. And they would have to figure out how to come back into this game. So what are the options open to this group of people? Do you see more of them coming and talking to you, or are they the sort that will try and internalize and try and figure it out themselves?
We do have callers who are business owners or who are people who lost their job. So we would normally refer them to the resources such as SkillsFuture or SSO when it comes to financial help. So for some business owner, we do have callers who are, for example, they are project drivers. They own their own taxis running, and because of the COVID and the circuit breaker period, they are confined, and therefore there are lesser customers using taxis during the early stage, and they lost their job. So then they are calling in, and we do refer them to SkillsFuture, and they manage to get some referral for courses or for them to reskill or relearn new skills for new jobs. So that's
I don't know how effective those things are, frankly, because if you've got a job, then getting you to do some other skills suddenly is not very practical. And I don't think it's something you can apply almost immediately, right? You've got a situation, you lose a job, you've got to start something straight away.
Yeah.
Skilling
I agree with
somebody
you,
in a different direction is
I agree with you. It's definitely a discomfort for many people who are, getting out of their comfort zone to do something that's different. I suppose they also do have coach there, organized by SkillsFuture, to explore what are the strengths of this individual and see if there's a match. And through one-on-one coaching, free coaching is available online. If you could just go on to SkillsFuture, you probably get a lot of those free webinars and talks to talk about how can one look for help. And having said that, I suppose in the meantime, in managing their stressors during this transition period, it's also important to maintain a healthy daily routine and stay connected. Because it's also the maintaining of the social connections that with friends, colleagues, or even social network online. You might chance upon somebody who could, give you some connections or help you out. So I think social connection is also really extremely important in terms of your well-being. Especially when I mean, there's a study by Harvard Studies that shows that social connection actually improve emotional well-being and increase the longevity of the life as well. So it's so important to stay connected, even if job seeking.
Cool. Well, we're at the end of the session. We've overrun a bit, but I just wanted to get a perspective from each of you on how COVID has changed you personally. How this whole experience has changed yourself in some, whatever way. If you could share that with the audience. Lena, let's start with you.
Oh well, I think on a lighter note, definitely the power of technology device. With a click of a button, I could order my groceries and get food home without stepping out of my house, But on the emotional management or wellness aspect, I think the level of self-awareness is heightened and I'm also more aware of the power of collective impact. Through this COVID situation, I realized that there are a lot of people from all walks of life coming together to support each other. You know, the social graces from everyone, and like Kanan will host this particular webinar to ensure that it benefits the general public. And I think these are the in times of difficulty where you see the social graces coming up. That's something that I'm aware of.
Okay.
Yeah.
Laika?
I mean, I guess I've had a lot more time to spend at home with the baby, which has been good. But in terms of changes, I think it's really forced me to embrace technology a lot more. That's one. But also, it forces you to reevaluate what you take for granted as well. Like even leaving the house is, put on your mask, make sure you do X, Y, Z things. You can't just go out casually for lunch anymore, right? So it's been a lot of reworking how to stay in touch with people that are important, and rethinking about boundaries, as we were talking about earlier, because previously I was physically going to class, right? So I would say, okay, go to class, come back, that's it. Now it's like, okay, I'm going to do this work at 12 a.m. I'm going to do these things. So it's a lot about, resetting the boundaries and reworking how to stay in touch with people.
Okay.
Like the social connections that Lena was talking about.
Cool. Varian?
Adjustment to new norms.
Adjusting to the new norm.
Yes.
I think for me, it's very similar. While there's been a lot of new opportunities, I can take courses online. I personally need to make sure that efficiency does not come at the cost of my boundaries. So I found that I needed to increase my handle on time management, on putting away the devices and making sure that my self-care routine is really in place, because it's very easy to fall into a lack of that, especially because I'm surrounded by technology and the devices, and now everyone is, we don't need a specific time to go to the office. Let's arrange for a session at 11 p.m. or 6 a.m. So really getting a tight handle on that, or in fact even tighter handle on that, has been really important to me, and just to make sure that I don't get too fatigued by the screen time.
Cool. Yeah, I think a lot of how COVID will play out will still be factored in as we move along. We haven't quite reached the end of the road on this one. So it's good to take some of the things that you've raised during the session and sort of actively use them, like managing your time better, understanding the importance of networks and keeping your communications avenues alive. I mean, thank goodness for digital, frankly, because imagine if we had this and we had no digital support. It was just stonewall faces and people, and that's it. You cannot reach out beyond the confines of your house. That would have been a lot worse, I think. So on the poll side, just let's look very quickly. The main concerns, job loss was, let's see, becoming lazy was one of the key ones at 41%. Picking up bad habits was another at 35%. Aversion to socializing, 18%. Losing contact with friends was another one. Health was one of the big ones as well. Not enough money, came below health. Okay, and job loss.
Yeah.
So those were some of the key areas.
I think job loss is one of the top ones, even in the calls coming in.
Yeah. But yeah, it'll depend on because your calls are kind of specific. It's not very general, so it would draw in people who are distressed in that line. So you probably get a larger number of those calls coming through. But Lena, Laika, and Varian, thank you so much for sharing your lunch with us and your thoughts and your ideas and your experiences. Look forward to the next chat, which we'll have next week. Meanwhile, as this edited session will be on the stormasia.com site. We will also put up some resources which Lena has provided and variance survey to test out how well you're coping with things. Have a safe rest of the week, and thank you again.
Thank you, everyone.
Thank you, everyone.
Bye. Thank you.
Bye.